We're going to start, though, with To Your Well-Being. Dr. Cynthia Snider, Cone Health's Infection Prevention Medical Director, is joining us to talk about what to do if you or someone in your household catches the flu, and also recommendations for what to do in the first place, you know, with the whole flu thing. All right, so let's just start with this, because you think to yourself, well, it's okay if this person gets the flu in my house, but not if this person gets the flu, and definitely not if I get the flu, if I'm the one who's taking care of everyone. So how prevalent is the flu right now?
So it is less than what it was, I would say, three or 4 weeks ago. We had a huge early surge of the flu season. And although we're still having cases, and the best protection people can do are things that they already know. The vaccine is very effective right now. So for this season, it's very well matched. If you haven't had the flu vaccine, it's still to your benefit to get it. And it's approved for anybody that's older than 6 months. And then also, we know that wearing masks is very helpful. It protects the person that doesn't have symptoms. It also, if the person who has symptoms can wear it, it prevents the spread to giving it to others. And then also, we know that your simple like cough etiquette and hand hygiene and wiping down like high touch surfaces. So it is possible that one person could get the flu in the same household and not spread it to others, but as long as they try to do as much as they can from preventing to expose others.
Okay, that is good news for all of us, right? When you're thinking about that just because one person in the house gets it doesn't mean everybody has to get it. All right, let's talk about what some of the symptoms are so that maybe we can kind of catch it earlier on and be able to detect it, and how the flu symptoms are maybe different or similar to COVID, RSV, and all that other kind of jazz, which are already spreading.
For sure. This season has been very perplexing for a lot of us. We know that there's flu out there, there's COVID, and then an RSV, as well as other cold strains. So the flu usually has, high fevers, sore throat, cough. It's usually a dry cough, but you feel like you have like just achiness of like your bone, yeah, like your whole body. The challenge is that the latest strain and previous strains of COVID seems very similar. So it is very important to also get tested for COVID to ensure that, if you're a candidate for treatment, that would make sense to get tested. And also it has implications for going back to work and also going back to school and such. So in a way, COVID and flu has a lot of overlap. In terms of other cold-like illnesses, you probably would not have as high of temperatures or body aches, and more just like nasal congestion and some cough.
Okay, so if someone in your household thinks that they have the flu, you kind of touched on this just a little bit, like, there is certain treatment for flu versus COVID. How can they treat flu?
For the majority of folks who are generally healthy, you kind of just stay home, stay hydrated, take medications for your fever, and obviously stay home so that you don't infect others at the workplace or at school or at daycare. And you can recover without much medical attention. However, if you are having such high fever, especially for kids, and they can't keep up with drinking, or they're not, maybe you're noticing that they're not going to the bathroom as much, or their cough is leading to shortness of breath, those are terms when you should seek medical attention.
Okay, and what about like Tamiflu or something of that nature?
Yeah, so there are some antiviral treatment, as you mentioned, like Tamiflu. However, in certain areas there may be a shortage depending on the area you live in. It's usually most meant for people to take early in the disease process. So if you've tested within a couple days of having symptoms, you would have the best benefit from it, but it's usually for people that are at risk for severe disease. So somebody has really underlying COPD or emphysema, already on oxygen. It's people who may have heart disease, those who are over 65. It is also safe for pregnant women who know that if you have flu, you can have complications from it. So, and it's usually given to folks who are hospitalized for flu at the hospital as well.
Okay. All right. So flu is one of those things where you might want to contact your healthcare provider. You might want to have an in-office visit or a virtual visit, or when do you have to go to the emergency room for flu? We're going to talk about that when we come back after the break. We are back with Dr. Cynthia Snider, Cone Health's Infection Prevention Medical Director. She's talking all things flu. So we always wonder, when is it time to go to the doctor? When is it time to go into the office? When is it time for the virtual visit? When is it time for the emergency room when it comes to the flu?
So if anybody's having significant like respiratory distress where you're having difficulty with walking, and breathing really short breath, those are the times when you need to seek care like very quickly, where you're going to the urgent care or going to the emergency room. However, I think if you are otherwise fairly healthy and don't have that much discomfort from it, you don't necessarily need to seek care. However, if I think folks who have multiple medical problems, the problem with flu is that it can trigger the worsening of other problems, especially if people have underlying lung disease. It can cause like maybe some you notice differences in your blood sugars for diabetics, or people notice like chest discomfort, maybe chest pain. And so in those cases too, that's when you should seek like very urgent care. When I would call your primary care doctors, and they can help assess having you either come in person versus coming in or doing a virtual visit. I want to dissuade people just to show up at the emergency room for testing. That's not the right place to get care. And luckily, though, we have like many sites in the community. There are several like minute clinics, such as at CVS and Walgreens, that can test for both, right? Can tell you if you have COVID and flu or both. Especially we have access to antigen kits, right? So that's also very important, that you yourself can go out and test yourself. And if your COVID test is negative, kind of doesn't mean you have a clean bill of health, right? You still should see how you're doing and follow up to being evaluated for flu, and if you need antiviral therapy.
Yeah, going to the emergency room just to get tested, whether it's for flu or COVID, I mean, you could be waiting there for a really long time, and then it kind of backs up everybody else who's got some more acute issues.
Correct. We just want to make sure people are seeking care at the right venue, and a lot of I think doctors' offices may also have access to testing for flu and COVID. So it's like that'd be one thing to ask when you call to make your appointment.
Okay, and I know a lot of people just say, and you see that commercial all the time, it's just the flu, but just the flu really can develop into a lot of other things.
Correct. I think the highest risk of what we're seeing, especially in folks who are older, is that it does create complications for their other illnesses and leads to hospitalization. The thing that we know so far is that the current vaccine that they've developed is really well matched. So we know that we've had quite a few hospitalizations and deaths that have been prevented from this vaccine. However, because it came so quickly, not a big percentage of the population already had the vaccine. So it's hard to tell if we're going to have probably yet another wave of flu in our community. And so I think the benefits of getting the vaccines are still there. So if somebody hasn't received the flu vaccine yet, it's a great time to go get one.
All right, we've got about a minute left. People always wonder, how long do I need to stay home from work or school if I've had the flu?
Right. In a workplace, usually at least within healthcare, we ask people to stay home, and they shouldn't be back to work. It's usually like 5 days. They shouldn't be coming to work if they're still having a fever. They should be fever free for at least 24 hours, not taking any medications to prevent that fever. We know that you're probably infected can be infectious for those first few days, about 4 days. And so staying at home makes the most sense. And then if people are kind of just feeling unwell and still have to attend somewhere, putting on a mask, does wonder at preventing infection from being spread to others.
Okay, so 5 days, but definitely 24 hours, fever-free with no Tylenol or Advil or anything. That is the key right there. Okay, thank you so much for your time and your expertise. You know, you can find a full recap from today's Q&A on WFMYnews2.com in just a few moments. Click in the To Your Wellbeing section.